Hello, everyone. This is Dr. DeSano from South County Smiles, reaching out to you on Tooth Talk Thursday. And we just want to go over a few things. We're gearing up for a reopening, and there's a lot of changes that we've been working on, and we just want to share some of those with you. Our reopen dates are looking to be May 18th for restorative care, and then with hygiene, we'll bring them back just a little bit later, probably June 1st. So that's our goal, is to get the practice up and running again by May 18th. You're going to receive something in the mail. It's going to be something that outlines everything, all the changes that I talk about here. So expect to see this either later today or tomorrow. And some of the changes that we're looking at making start before you even come into the building. And that starts with the confirmation call. So you'll receive a call usually a day or two before, and during that call, you'll have a receptionist ask you a few questions. Maybe you can go over those, Lauren?
Absolutely. So we plan to do, as Dr. DeSano said, a phone screening. With that, we will be asking, symptom related for you, immediate family, just again to start the screening process prior to entering the building for your scheduled appointment. So again, are you having any cough, fever, all of the COVID symptoms? And if it's something that you do and we need to postpone treatment, then we obviously will take care of you at that time.
Then on the day of the visit, you'll come in, or first you'll get a text in the morning, and that text will have a wellness form attached to it. It's a digital form. You can fill it right out on your phone, and it'll ask you 5 basic questions, same type of thing that we asked you verbally over the phone. And so fill that in. It automatically goes right into our database. And when you arrive here in the parking lot, go ahead and text us and let us know that you're here. You're going to wait in the comfort and safety of your own car. And what we're going to do is we're going to get everything ready for you, that being the room and the provider and all of that. And when we are, we'll let you know. We'll send you a text back. That means you can come into the building and there'll be someone there to greet you. That person will be in PPE, personal protective equipment. That's going to include a gown, a mask, and some other personal protective items. So you'll be taken right to the screening station. The screening station is where the waiting room used to be. Our waiting room is basically not going to serve much as a waiting room. There will be certain situations where we need to use it, but for the most part, it's going to be our screening station. And maybe you could go over some of the things that we do at the screening station.
So before we take you to the screening station, we are going to be asking all of our patients to wear booty covers or shoe covers upon entry. With that, we will also be providing masks should you not present with one. And then we will be taking you to our screening station, in which our provider will then be taking your temperature. We'll also be taking your pulse oximeter just to make sure everything's within normal limits. And then again, we will review those screening questions for the 3rd time. So you'll hear the questions a lot, but again, we're just making sure nothing's changed and that we're keeping the safety of you as well as our team in mind. After you finish the screening station, we will then provide gloves for you to wear to limit any cross-contamination throughout the building. And then that provider will then escort you to your operatory.
So at that time, basically you will bypass the waiting room, go straight to the operatory, have a seat in the operatory. We're going to see one patient at a time, so it's going to be one in and one out, and that's why we want to do this curbside check-in so we don't have multiple patients in the building at the same time. And then you go through the procedure as normal. There will be a lot of changes during the procedure, again with the PPE. We're going to have 2 levels of PPE. The first level you would have been exposed to at the screening station, which is what I described earlier with the gown and the mask. And then in the rooms, that's going to be even a higher level of personal protective equipment. It's going to involve a face shield and a hair cover as well. So that will be pretty much standard procedure. Also in the operatories, you're going to see a few other things as well. You're going to see an external suction machine. We've always used an internal suction machine, whether it be the high volume suction or an Isolite or a rubber dam. We've used those in the past. We'll continue to use those because they capture the aerosol. But also what we'll do is we'll have an external one that will be picking up any of the external aerosol that we didn't get from the internal one. So you'll see that also throughout the office. You'll notice that there's going to be filtration systems, HEPA filtrations. We're having these custom made for our office, and they will be arriving next week, and we're going to place those in the rooms throughout the office. And it's a medical grade. It has UV light involved with it, and it's going to basically recirculate that air every 10 to 15 minutes. And so some of the other safety precautions we're making to our facility, and as far as our procedures, I can have can you mention those, Lauren?
So we'll also be utilizing, as Dr. Desano briefly touched upon, UV light for sanitation purposes. So this will be an after-hours sanitation protocol, and that will involve utilizing these UV lights to emit their sanitation and clean the operatories more thoroughly, and bathrooms and all of that will be included with these UV lights. This weekend, we are having a microshield placed throughout our office, and what that is it's an antimicrobial surface coating in which is being sprayed over everything that you can possibly imagine throughout the entire office. So this coating acts as just an additional layer, and there is research about it. We will post the link should you have any questions or want to research it for yourself, but we will post the link so you can visit the website and find out more information. But again, the coating's been proven effective to work against over 90 pathogens, and it does include the ones that cause COVID-19. So again, this will be happening this weekend, and everything will be coated, and again, just adding that additional layer for protection for, again, all.
And we're going to do the best we can to isolate the rooms, meaning put doors on the ones that we don't have doors on. We do have doors on some of our rooms, but so that may be a difference that you notice as well. We'll put links in there with all these technologies, the UV technology, the custom medical grade HEPA filters, and the MicroShield 360, etc. So you can do your own research. I know there's a lot of people out there that are concerned about coming back to the dentist. I'd like to think that we're going above and beyond what all the governing agencies are telling us to do, and that's for the safety of all our patients and the staff as well. So as far as the big thing, the most important thing, team training.
Absolutely. So over the next 2 weeks prior to our anticipated May 18th startup date, we are going through extensive team training, getting everyone comfortable and with the new protocols, the new PPE, how to clean the ops, all the new disinfecting protocols and everything. So they're comfortable and confident, and also we're ready for your arrival.
So we're starting that training this week. It's going to extend probably all the way up until the 18th and beyond. And just so we have everyone fully confident that they're going to be able to take care of your dental experience in a safe way. So if anyone has any questions, feel free to leave them in the comments below. We'd be glad to ask anyone, answer any questions anyone may have. So thank you from South County Smiles, and we'll hope to see you soon.
Looking forward to it.
Bye.
Take care.